My top tip for anybody who was told they needed a CT scan is just go for it. It's all part of the process of A, finding out what's wrong with you, and B, starting to put it right.
A patient might have a CT scan instead of an ultrasound scan or an MRI scan because their referring doctor has determined that this is the best imaging type to use for the condition that the patient has.
The oncologist told me that he was going to book a CT for me. I went home and then got a card through the door giving me the time and place for my CT scan. I had to signify on the form by ticking a box whether or not I was asthmatic, diabetic, and whether or not I was taking the metformin.
If there are any concerns with any of the questions and the safety information that's sent out to the patient, do just call up, do not hesitate to call up and speak to one of our receptionists. The person on the other end of the phone will go over any alternate options that we have for the patient. We ask patients to fast themselves just for 4 hours before their scan time, just so that if they're given a contrast injection, the likelihood of an adverse effect is reduced significantly. If you have to eat within the 4 hours and you contact the department ahead of time, we'll be able to tell you whether we can go ahead with your scan normally.
Because the parking is not necessarily all that easy, I decided that I would go to the park and ride on the edge of town and come in on the bus, which stops right outside the entrance to the hospital, so it's very convenient.
Patients can bring along a friend or family member to their CT appointment. The friend or family member will be asked to wait in the waiting area. They cannot come into the scan room with the patient. This is due to the radiation of the scan, and only the person being scanned should be in the room.
When I arrived at the hospital, I knew where I needed to go, followed the signs to radiology, and checked in at the reception there with my appointment letter, which obviously had my hospital number on it. They checked me off on the computer screen, and I got asked my date of birth almost at every turn, and every new person that I saw checked my date of birth, which I found quite amusing to start with, but I'd realised the importance of it to make sure that they have got the right person.
When the patient arrives in the CT department, the first person they'll meet is the receptionist, where they will hand over their appointment details. The receptionist will book the patient onto our computer system, which informs the radiographers that the patient has arrived. The patient will be asked to wait in the waiting area. After a short time, a CT helper will come and collect the patient and take them to the changing room in order to get prepared for their scan. So they'll get changed out of their clothes and pop all of their possessions in one of the secure lockers in the changing room.
I wore my own clothes, which it said had to be loose fitting, but if they have metal on them, then I had to take them off and put the gown on. And obviously there was a metal zip in my trousers, and on my belt there was metal. So I stripped down to modesty levels of underwear. When I left the waiting room, I was taken into the cannulation room, and he explained that I would need a cannula in my hand, which would put another contrast dye through my blood vessels while the scan was going on. He put the cannula in. It was reasonably painless. I think the dye is there purely to show up blood vessels which ordinarily wouldn't necessarily show up on the scan.
The cannula is a small plastic tube that fits into one of the veins in the patient's body. A cannula is necessary for some CT scans because we want to administer a contrast agent into the patient's circulatory system, their blood system. Now, the contrast agent is used to highlight blood vessels all throughout the body, and specifically in any part that we're looking at for the patient's CT scan. Having a cannula put in is uncomfortable at worst. There is a small scratch sensation as the cannula is placed into the skin, but afterwards the needle is removed and the cannula is just a small plastic device that allows us access to the vein. There are a few side effects to the contrast agent. You may have a warm sensation travelling around your body when it is injected, or you might get a metallic taste at the back of your throat. These are usually the only symptoms you will get from the contrast agent.
When I was sat in the waiting room, I was then called by the radiographer who came out and told me they would take me into the scanning room. I went in, and it was a room first impression, a really clean room with lots of equipment in it.
The radiographer will bring the patient into the CT scan room and get them set up on the table. But while the scan is actually being taken, the radiographer will move into the control area, which is a room just adjacent to the scan room, and perform the scan from there on a computer, looking through a window so that they can see the patient the whole time.
The bed by the scanner is hydraulic, I suppose. It goes up and down. So the radiographer will move it to the right level for you to sit on and swing your legs over and then to lay down.
All that's going to happen is the patient's going to lay down on the bed that passes through the middle of the hole in the CT scanner while the X-ray tube is spinning around them. This makes a bit of noise, nothing that would make them uncomfortable, no ear protection is required.
But when it's actually in operation, it's like a big heavy wheel going round and making a noise. The nearest I could come to it is like the spinning cycle on a flaming great washing machine. It's a mechanical spinning drum.
The patient's main job is to keep nice and still. This is like any picture being taken. If the patient moves around, we get blurry images come out and they're less accurate for diagnostics.
You should always try and stay as still as you can, because if you just think about any photography, if you move, it's going to get blurred.
Depending on what scan the patient is having done, what body part they are having scanned, will depend on their position in the scanner. Usually we do this feet first. For the majority of scans, the patient lays down with their feet facing towards the scanner, facing up towards the ceiling and laying nice and still. For a couple of scans, such as a CT head scan, they will be turned around so that the head will be going first into the scanner. If it's easier for you, you can keep your eyes closed during the scan. And the thing to remember is that the scans are very short. It'll be a few seconds in and out and they'll be done.
When you're on the scan and you're in the room on your own, you hear the mechanical voice telling you what to do, pre-recorded voice. But also you know that the radiographer is behind the screen and he can talk to you as well. But they tell you when they've finished. And if there was any issue, if I was in pain or anything, and I would call, they would be there straight away.
While the radiographer is out of the room performing the scan, if the patient wants to get their attention at any point, sometimes they can just speak and the radiographer can hear them through the microphones, or they can just wave their arm a little bit just to indicate that they want the radiographer to come through to them.
There is no pain caused by the scan itself. The only pain was because I had to have my arms up so high, and wasn't that long after my surgery, and it was slightly painful for that reason, but the machine itself gives you no ill effect at all.
Once the scan is finished, the radiographer will bring the patient straight out of the scanner and sit them up again once the cannula has been taken out.
When the scan is over, the radiographer comes through, makes sure I'm clear of the machine, lowers the bed to the appropriate height for me to get off it. And then I get off and they make sure that I'm able to walk okay, escort me to the door and tell me to go and get dressed.
Even though the CT scan uses radiation, the patient does not become radioactive after the scan. Patients who have had a contrast injection are suggested to hydrate themselves, to drink plenty of clear fluids after the scan. This is just to help the contrast flush out of their system now that it no longer has a use. There won't be any side effects of it passing out of their system. The patient won't see or feel anything different when they pass water, but this hydration just helps to speed things along, the body's natural process of expelling the contrast.
There was no nausea, no ill effects whatsoever. Although I was able to go straight home, the first stop was up to the bistro for a cup of coffee and a sandwich.
The radiographer will immediately check the images for quality to make sure that the patient hasn't moved and that all the information will be there for the radiologist to make results and diagnosis.
The results, I believe, go to the doctor, in my case the oncologist, within 5 to 10 days. And then I get called to see the oncologist and he gives me the results.
The results that we get from the CT scan will help the clinicians helping you to get the best results and to determine what is going on so that they can go on to the next steps sooner in your treatment or diagnosis. If you don't turn up for your CT scan, you may experience delays in this treatment or diagnosis of your condition, which obviously is something we want to avoid as much as possible.
Having a CT is an integral part of any diagnosis. And the final one I had, which then gave me my all clear, was absolutely priceless.